The University of British Columbia, founded in 1915, is a global center for research and teaching, consistently ranked among the 40 best universities in the world. The UBC Faculty of Dentistry has served as a leading dental school since 1964, having recently been awarded the top dental school in Canada for 2017 and within the top 30 dental schools in the world based on academic reputation, employer reputation, and research impact. While the graduate orthodontic program was only founded in 2010, UBC has been at the leading edge in many areas of research, including the orthodontic considerations of obstructive sleep apnea, the fundamental mechanisms of craniofacial morphogenesis and development, as well as the long-term effects of serial extraction and palatal expansion. Faculty member Dr. Ben Pliska has studied changes in upper airway dimensions from CBCT scans between extraction and non-extraction groups of adults from before and after orthodontic treatment, being featured in the December 2016 issue of the American Journal of Orthodontics and Dental-Facial Orthopedics. Key findings were that extraction orthodontic treatment does not constrict the upper airway in adults and that there was a wide amount of individual variation in airway dimension changes with treatment. UBC's involvement with obstructive sleep apnea research was initiated by the pioneering work of Dr. Alan Lowe, inventor of the Clearway appliance, who retired from the faculty in 2016. Early studies first validated the use of mandibular advancing oral appliances as a treatment option for adults with OSA. Work by Dr. Fernanda Almeida and Dr. Ben Pliska characterized the changes to the dental occlusion commonly observed over time in sleep apnea patients using advancement appliances. Common changes include reductions in overjet and overbite, posterior open bite, and severe protrusion of the mandibular incisors. The department has also investigated predictors of mandibular advancement appliance treatment success with a focus on nasoendoscopy of the upper airway, with postdoctoral fellow Dr. Kantaro Okuno receiving publication in the May 2016 issue of the European Respiratory Journal. The research found that compared to non-responders, those treated with mandibular advancing oral appliances displayed significantly larger increases in cross-sectional airway ratios from rest to protruded positions, and that the expansion ratio of the velopharynx was an independent predictor of oral appliance treatment outcome. As a follow-up to Dr. Pliska's long-term study on occlusal changes caused by oral appliances, doctoral candidate Dr. Mona Hamoto's research has focused on determining the nature of the changes associated with long-term oral appliance treatment and to evaluate the magnitude and progression of these changes. As a result of this research, Dr. Hamoto placed first for a graduate student research award by the American Academy of Sleep Medicine in 2017. While a relatively new program, the UBC benefits from the clinical experience and expertise of many part-time faculty, especially Clinic Director Dr. David Kennedy. Dr. Kennedy's meticulous record-keeping over his years in practice have allowed for several projects examining the long-term effects of orthodontic treatment. Past resident Dr. Abdul Qadir Bakari studied the dimensional changes in the palate associated with early treatment of posterior crossbite. Changes in palatal width, surface area, volume, and molar angulations were measured using digitized models and 3D computer-aided design software. Main conclusions found were expansion across the canines and first permanent molars was almost similar, and that while the palate was symmetric before expansion, it became asymmetric after expansion in the middle halves. Using a novel approach of measuring occlusal curves with the variation of Monson sphere, Dr. Esther Feldman was able to demonstrate the changes that occur in occlusal curves from physiologic drift after serial extraction to the end of fixed orthodontic treatment. UBC's orthodontic longtime faculty member Dr. Virginia Dewart has made tremendous contributions to the fields of craniofacial embryology and development. Having studied a rare collection of human fetal samples as well as animal models, images from her collection of slides can be found in many leading embryology textbooks, including the cover of the latest Craniofacial Embryogenesis and Development by Sperber. A new faculty member at UBC, Dr. Sid Vora, is continuing this work by applying advanced 3D imaging and morphometric tools as well as computation shape analysis methods in fetal craniofacial development. These studies aim to uncover the growth trajectories of individual craniofacial bones, integration patterns between different regions of the developing skull, as well as studying symmetry and asymmetry patterns through the second trimester, a time when the adult head shape is beginning to take form. Dr. Vora's research also utilizes mouse models in establishing the role of genetics, epigenetics, and the environment in influencing and regulating craniofacial morphogenesis with a focus of craniobasal growth and tooth development. UBC Orthodontics faculty members Dr. Angelina Liu, Joy Richmond, and Sid Vora are also researching various aspects of cleft, lip, and palate ranging from understanding its pathogenesis at the molecular and cellular level to clinical research investigating treatment outcomes utilizing a large collection of longitudinal data on facial growth changes in patients with cleft lip and/or palate. Residents in the orthodontics program are also actively involved with basic science research related to craniofacial growth. Dr. Adrian Dinescu is a PhD orthodontics candidate and a past recipient of the prestigious Canadian Institute of Health Research Award. Dr. Dinescu's research is related to craniofacial development birth defects using an in vivo and in vitro chicken embryo model. Both faculty and residents at UBC continue to be active in their pursuit of research in the realms of obstructive sleep apnea, craniofacial morphogenesis and development, cleft lip and palate, and long-term effects of serial extraction and palatal expansion.